Hi, I'm Dr. Tony Sara, President of ASMOF New South Wales and Federal ASMOF. On National Doctors' Day, I wanted to send a message of thanks to doctors working in the New South Wales public health system. The past few years have been an immensely tough slog for doctors. First the bushfires, and now especially COVID, and just recently the floods. I know that saying thank you is not enough. Our doctors' salaries and working conditions in New South Wales are the worst in mainland Australia. This is not acceptable. This is why ASMOF New South Wales is prioritising award change. The New South Wales Government wages policy means that doctors, nurses, teachers and other public sector employees are unable to negotiate fair or even reasonable working terms and conditions. The union movement is united against this policy. Also in discussions with the New South Wales Ministry of Health to renegotiate the awards without the constraint of the wages cap. The negotiation process will be comprehensive and will be member-driven. The more members we have, the stronger our negotiating position. Thank you again most gratefully on National Doctors' Day, both for who you are and what you do for the patients and the profession in New South Wales.
Hi, I'm Yvonne. I'm one of the Doctor in Training co-chairs for ASMOF. For National Doctors' Day, we really wanted to thank all of you guys, all of the doctors in training, for what you guys have been doing in the last 2 years. I mean, even from interns and residents who, some of you guys have never worked outside of the pandemic, to SRMOs and registrars and fellows and ATs who've been in the system for a really long time. We know that you guys have had to put up with a lot in the last 2 years, like all this disruption to your work-life balance, having to work so much more overtime, the disruption to your training and your education. There's been a lot that you guys have put up with. And we know that the system was broken really a long time before the pandemic even began. And even now, though people are using the pandemic as an excuse for rostering practices and changes to your education, training and things like that, it's really not on because it's gone on for so long. And we really hope that what we can do for you guys this time is make some long-lasting change to make sure this doesn't keep happening. So you may have already heard about the ASMOF legal action at the New South Wales Supreme Court. And you might be wondering where that's up to. We are currently waiting for the court to give us the dates and the timetable to file the evidence for the first lot, the first claim, which includes a lot of statements from doctors in training about the expectation to work unpaid overtime. And in the meantime, the lawyers have already got enough evidence to file a second claim, and they plan to keep filing claims and claims and claims to put pressure on the New South Wales government to do something about our award. Sometimes as individuals, when we're coming up against our employer, we can really feel like there's nothing that we can do and nothing that we can change, and to sort of buckle down and keep going and not say anything or not do anything. But on National Doctors' Day, I really do want us to think about the power that we have as a collective to make change. Where we come together, we do it as a whole, for each other and also for future generations of doctors as well, and for our patients, because we all know that when we are safe and we are protected, our patients are safe and protected too. So thank you very much to all the doctors in training again for everything that you guys have been doing for the last 2 years. And thank you again for your support of the campaign for ourselves, for our colleagues, and for the next generations of doctors.